So I want to make sure that we have the federal funding to keep our rural hospitals open. I think that is so important to have because I'll tell you a little story and I'll make it quick. I have a friend that's in Delaware County. Love him to pieces. His father just recently passed about a month or so ago, and time is constrained right now. And they were trying to get him to the hospital, but because the hospital was closed in Sallisaw, Stillwell. It's a lot of S's around here, okay? In Stillwell, and they had to try to get him over to Arkansas, and they couldn't get him over there in time, and he died. This is right here at home. So what do I want to do? I want to fund our hospitals. I want to make sure that we have the staffing because workforce development is super important. Making sure that no one has to die on their way to a hospital. Does anyone here, and please, you can all speak at once, does anyone here have to travel out of state or over to Arkansas, Missouri, or Kansas to go get health care? How's your drive when you're over there?
It's pretty good, so it's 65 miles.
Is that an hour or so?
Yeah.
Or do you use VA?
Yes.
You do? So instead of going to Tulsa, you go, oh yeah, because I just saw your hat. I'm sorry, I was looking at you as a person, I promise. But nice fit though. You look good. We'll get to that in just a second because I know, and I've done my research, that there's 2,837 veterans right here in the road. Thank you for your service.
Thank you.
But speaking of healthcare, I want to make sure that the VA is fully funded as well, and we actually can maintain and retain the healthcare professionals, so you don't have to wait X amount of months to be able to be seen. I think that's important. But this is why healthcare is something that is very prevalent. So what do I also plan to do? And I know that sometimes these things can be a little mundane, but some people don't think of these things. So I know that 27% of Delaware County is 65 or older. I do. So I know that at this point in time, healthcare is something that is absolutely prevalent in need. So one thing that I do want to introduce into some legislation when y'all get me there, is I want to have diabetic and podiatric preventative care. Okay? So what does that mean? Oh, right here.
Thank you.
You're so welcome. But as a nurse, that's important to me because when I would have, especially when I was going through nursing school, I would have a lot of wound care patients come in. And they were diabetic and they would have wounds on their feet that they didn't know that they had. But that's because they have neuropathy in their feet. Do I have any diabetics in here? Oh, you're just my star child today, aren't you? But they would have, do you have to check your feet every day?
Not really, but
I will ask you, so I won't go too personal deep into it, but it's always good to have experienced people who can actually tell the tale of it. That's all the experience matters. But I want to make sure that we don't have to spend $70,000 on getting your foot amputated or your leg. I think having preventative health care, such as going to go get a pedicure, having them check your feet,
Specialty shoes.
Yeah, making sure that you have access to transportation to your doctor's appointments, something that is much cheaper. $50 to $100 just for a pedicure, that's nothing that we can pay. It's nothing. It's nothing. And it helps you keep your foot. That's what I want. Those are things that I want to get back to the community and implement and build legislation around because that is called people-focused policies. No one ever thinks of those things unless you are directly involved with that. So that's part of my healthcare policies. That's not all of them, but I'll keep you here forever if y'all want to. Y'all don't want to be here all day, so that's great.